We're going to give a general overview of left palatal anesthesia. We're going to break it down into 5 separate steps. We're going to look at it from various vantage points and also in slow motion as well, so you can get a firm sense of how this is done. Let's look at it in real time first, and then we'll break it down into smaller steps. So this is in real time. You place a frozen cotton swab against the palate. The assistant holds the cotton swab. You take the anesthetic syringe, place it right next to the cotton swab, and inject and return the syringe. This will allow you to give completely painless anesthesia. There are 5 steps to this. Number 1, establish visibility. Place the cotton swab saturated with endo ice. The assistant then holds the cotton swab. You pass the syringe, give the injection, and then return the syringe. These are the 5 steps. The first step is to establish visibility. Initially, when you're learning this, it's helpful to use a larger mirror because it's a little easier. Later on, as you gain facility, you can use the normal mouth mirror to do this. So, accepting the mirror, you go in and you visualize the palate. Typically, during this time, the assistant will defog the mirror with this suction. Freeze a cotton swab with endo ice. And place the cotton swab perpendicular on the palate so that it's easy for the assistant to keep a steady position with the cotton swab. Here you can see I'm taking the cotton swab. I'm going to position it right on the palate, and then the assistant is going to hold that cotton swab in place while I inject. Here we pass the swab, and here Joy is going to hold the cotton swab right against the palate. This freezes the palate and makes the injection completely painless. Joy is now defogging the mirror with the suction, and then she will hold the cotton swab with her left hand. So the third step is holding the cotton swab steady. The assistant is looking through the microscope while she is doing this. From another angle, you can see the positioning of the assistant's arm while she is holding the cotton swab. We're demonstrating this with both the larger and the smaller mirrors. There, Joy's placed her finger against the cotton swab and is putting vertical pressure. This holds the cotton swab in one location, which is critical for the injection. The endo ice freezes the palatal tissue, and it makes the anesthetic injection completely painless. You accept the syringe, and then you place the needle right next to the cotton swab. And when you go into the palate, the patient cannot feel that. Inject 1 drop at a time. A slow injection is critical, obviously. Here it is in slow motion. So you can see the assistant is holding the cotton swab. I take the syringe and I put it right next to the edge of the cotton swab. The assistant is defogging the mirror there so I can see perfectly. And the palate is injected 1 drop at a time. Then the cotton swab is removed as you complete the injection, 1 drop at a time. We have universally found patients that will report that they felt absolutely nothing from the palatal injection. Here it is from another angle. I'm placing the cotton swab. Joy is now holding the cotton swab perpendicularly against the palate, and then she is passing the syringe to me, and I inject. And she is suctioning with her right hand. Let's take a look at this in slow motions, because when you first try this, it may seem somewhat clumsy. I'm positioning the cotton swab perpendicular so it doesn't slide around the palate. I move my hand out of the way so Joy can grab the wood stick of the cotton swab. Then I ask for the syringe, and then Joy comes in and she is suctioning the mirror so that it stays defogged while I inject. After the first few drops go in, the cotton swab can be removed, and you complete the injection slowly. You can look down at the patient if you need to see their facial expressions, just to assure yourself that they are not in any pain whatsoever. We have never had a patient report any pain with this kind of an injection. To return the syringe, the same protocol is used. You bring the syringe out, aim it away from the assistant, keep your hand steady, and don't move it until she takes the syringe.